Dr. Bruno is an internist in Brazil, and one of his colleagues, Caroline, is a nurse at a public hospital. These are the overtaxed facilities that are funded solely with public money to help the least fortunate and unfortunately the most at need during this crisis, but not just during this crisis, all the time. And as we've seen with COVID, it's simply exposed the challenges that have always existed and really discovered where we've underfunded our system and left those most at need at the most risk. On a daily basis, Caroline experiences feelings for a lack of safety, not only for herself, but also for her colleagues. As one of her colleagues said after her shift, "I just need to burn my clothes," because she felt as though she was, quote, swimming in the virus all day. When she turns to her leaders to ask for help, they feel just as helpless as she does, partially because they can't roll up their sleeves and do her job, but also they never trained for circumstances as severe as this. So a lack of safety for herself and her team, coupled by leaders who are helpless to assist, leaves Carolyn feeling really emotionally damaged. And paradoxically, the best way to heal that damage is through vulnerability and connection. But she doesn't feel she's in an environment where that's okay. And it stops her from connecting with her colleagues. It stops her from connecting with her leaders, and it's preventing healing among the team. The Dr. Jeff's going to share a little bit about what we uncovered with some of the workarounds or some of the challenges that further exacerbated these emotions. Jeff?
Yeah, so what do people in healthcare do when they're facing challenges that keep happening over and over again? Well, one thing that they do in a worst case scenario is they burn out. Another thing they do is start to try and innovate and create workarounds, as Jeff mentioned. And they increasingly are starting to share their stories with their peers, with people that they trust. They may create private Facebook groups. They may call up people that they trained with and haven't seen in years, and they're starting to share what they're experiencing from day to day. Meanwhile, their leaders are beginning to hear these stories and begin to become aware to the severity of issues which have many been long-standing. In thinking of this from what's known as the Kruger-Dunning framework, the leaders are going from being unskilled and unaware, kind of blind to the issues there, to now beginning to see the problems and being aware of how unskilled they've been and wanting to be better at that. And one of the big things that they're aware of is the need for not just physical safety, but emotional safety, how important that is to the folks on the front line. So it's with this desire to capture the emotions as well as the physical challenges being faced that we offer our humming state.
I'll just jump in then.
Yeah, I'm going to project it now, but keep going, Dr. Bruno and Shamali. Tell us about the humming state.
Yeah, thinking on the side of the frontline worker that is afraid of feeling vulnerable and is unable to get a sense of caring for each other. And we figured out that we needed to enable people to care for each other, and so that we could have the unit's health state. And that way we could enable everyone to feel vulnerable, but to have metrics and indicators so that they could figure out how to move from that state and to go to a humming state, as we called.
So what we did was we came up with this idea of humming and prototyped it a little bit. So humming is essentially going to be a monitor which these nurses that you heard about in Dr. Jeffs and Dr. Bruno describe about. These nurses and other frontline healthcare workers can wear it. So it could be a wearable that that could be kind of around their necks, or it could be just on their PCs or tablets. But essentially, this wearable would have a way to record some of their conversations. So it could be voice activated. So if they are really in that point of despair and feeling super vulnerable, they could just kind of record their feelings and what journey they're going through that particular day. And in addition to that, we could also have some other inputs, which Dr. Bruno just described, to see how they're feeling. Are they feeling safe? Do they feel their leadership is supportive of them? Is there any way they can work with the leadership and affect a change so that everybody is lifted up from this situation in a better way? So once you get those inputs in to the monitor, through the monitor, you run some agile analytics on it and make sure that those sentiments and everything is kind of getting translated into something a little more concrete, so that the frontline healthcare leaders can use those dashboards to make decisions or work with the frontline healthcare workers to come up with a good plan to mitigate them from feeling vulnerable, and in turn make their vulnerability into a superpower, which is better for the entire organization as well as the patients it serves.
That was bloody brilliant. Amazing.
Jeff, just add one thing, that when we got started in this, what we said we wanted to do was like capture the vital signs of the people working on the unit, the same way that the health of the patients they're caring for are being monitored.
Okay.
Yeah, thanks, Jeff. I didn't make that clear in my intro, and that's something that would probably be helpful to give others context going forward. If you can just tell us where you started, so that we know the breadth of your journey. Clark, as a process expert, what are some of your opinions?
The compelling need of frontline healthcare workers is the extreme case that you're solving for. And probably all of us, certainly I was thinking this would be wonderful for people that are also not on the front line. And so designing at the extreme and testing at the mean is an idea that comes up. I think in process terms, this is such a wonderful demonstration of the process at work. And everything from the humming state to how we understand it is present with this. And I salute you for a wonderful piece of work.
I know I was in the kitchen when they were baking the cake. But it was just amazing how this whole thing turned. And like it went from completely not making sense to totally making sense. Mm-hmm. And I know I cued you on this yesterday, Dr. Jeff, so I hope you had time to think about it. But Dr. Jeff was definitely one of the people who, because in our, just as a a glimpse into our team's functioning, Dr. Jeff came up with this idea, superpower. And I think when he was ready to start coming up with the solution, we kept diverging. And it wasn't like, he used a great expression, it was very candid. He was like, I'm just not that jazzed about like where we're at. And, it was totally one of those trust the process, do the work kind of moments. And we did come back to what he said, but we came back to what he said in a much richer way. by sitting with that discomfort or that comfort with ambiguity. So Dr. Jeff, just for everyone's benefit, what was your aha moment, or when did things really turn for you?
Well, you've mentioned this idea of vulnerability as a superpower. It was hearing actually from a doc that I'm working with share his experience of both feeling afraid as he put on his mask to enter the work environment, and noticing that he was telling people about his fear and hearing others share their similar experiences. And so he was aware enough to say, you know what, I'm willing to make myself vulnerable. My friends, peers, some of whom I may not have heard from in many years, are also willing to do the same. That's different. There's something happening here that helped move this forward, both from the standpoint of appreciating the value of that, as well as clarifying what the need really is.
Nice. That was cool. I mean, your friend in three quick bullets, you know, your colleague moved from being inspired. He recognized the challenge and he was inspired by the opportunity to make it better. And he moved to being inspired to make that difference and connect and model that vulnerability. That was super awesome. Johan, I appreciate your comments in the chat. You said that a team 2 weeks ago that were looking at how to make interactions among employees more trusting. What did you come up with, and what did you tell us more?
Unfortunately, I cannot tell you much more. The team they ran
Super
off,
secret?
and no, not at all. But well, they keep it secret from me. They're off, and and they are busy designing, and it so resonates with me because I listened to you, Dr. Jeff, and I see that this is the workplace atmosphere that I would like to have. Not only in frontline healthcare, but also in office, where vulnerability is something that we strive for, something that we use, and something that's not looked upon as a weakness. I would really like that.